Rosa may wish to bring a claim against her employer, the Tate Art Gallery. It's been established by Wilson and English that employers have a duty of care to their employees, which means that they should take all steps which are reasonably possible to ensure their health, safety and well-being. Tate Galleries, as Rosa's employers, owe her a duty to provide a safe workplace environment. Whether Tate Galleries has breached its duty in ensuring a safe workplace will be judged against the standard of care by any other reasonable art gallery employer, as stated in Donoghue and Stevenson. Arguably, any other reasonable art gallery would have taken more steps to protect Rosa from exposure to the chemical solvent, for example by providing protective masks or more air ventilation. So Tate Gallery may have breached their duty of care. There are some other factors which suggest that the Tate Gallery has been in breach of their duty. Firstly, the risk of harm when exposed to artium is fairly high, as it has been medically proven to increase the chances of contracting lung cancer. This is something that the art gallery should have had in the contemplation of mind, as Rosa is more likely to contract cancer. Therefore, they should have taken more steps, as stated in Bolton and Stone, to provide safety equipment and prevent this happening. Also, with reference to Paris and Stepney, because the potential harm as a result of the Tate Gallery's negligence is cancer, which is a life-threatening serious illness, the high level of severity suggests that the Tate Gallery should have taken greater steps in order to protect Rosa from the artium exposure. As demonstrated in A and C and Latimer, the cost providing precautions such as protective gear or masks or more air ventilation would not outweigh the risk that Rosa faces from exposure to the artium. Providing masks will be a fairly low cost in relation to the massive risk of contracting cancer. With all these factors taken into account, it's likely that the Tate Gallery has breached its duty in providing a safe workplace environment. Whether the Tate Galleries caused Rosa's harm, in fact, is quite a complex situation. It has to be shown that on the balance of probabilities, the Tate Gallery caused the lung cancer. Usually the but-for test applies, Barnett in Chelsea and Kensington, but there are some exceptions. So, in a similar way to Wiltshire and Essex Area Health Authority, there are several possible independent causes of the loss, because Rosa volunteered at a church which exposed her to artium and uses artium on her personal projects. There might be difficulty then in showing that it was the exposure by the Tate Gallery which caused Rosa the lung cancer. Furthermore, as the medical community are unsure whether lung cancer develops due to cumulative exposure or just a one-off exposure, the Tate Gallery may argue then it's not possible to pinpoint the exact actual cause of the lung cancer, whether it was her personal exposure, the churches, or the Tate Galleries. As it stands then, there's not enough evidence to establish a definitive cause. But, in response to this, Rosa may argue that despite the confusion of which exposure caused the cancer, using the McGee test, the exposure by the Tate Gallery did materially increase the risk of Rosa contracting lung cancer. And applying the Wagenman test, the lung cancer is definitely a type of damage which is reasonably foreseeable by the Tate Gallery when exposing Rosa to artium, as it's been medically proven that exposure to artium can cause lung cancer. The loss is not too remote. Tate Gallery may argue that the medical negligence by Dr. Khan was an intervening act which made Rosa's loss worse, as her survival rate decreased significantly, meaning that they should not be liable for the full extent of the injury. But to be a novus actus interveniens, the intervening act must be unforeseeable, as demonstrated in Knightley and Johns. It's unlikely that the Tate Gallery would have foreseen that Dr. Khan would make a wrong diagnosis, as it is rare that doctors do make mistakes such as these. However, there is a big question mark over whether the misdiagnosis could be a valid cause, and it depends on the percentage of survival of Rosa, but I will discuss this point later when I talk about Dr. Khan's claim. As there are two potentially liable parties which are partly responsible for Rosa's cancer, the Civil Liability Contribution Act 1978 provides that the courts apportion the damages between the parties responsible. Also, the Tate Gallery may also raise some defences. The first one, contributory negligence under the Law Reform Contributory Negligence Act 1945. Rosa was acting negligently, as in Freeman Butcher, by voluntarily exposing herself to artium when volunteering at the church and by using it on her own paintings. And she should have foreseen the potential consequences of developing lung cancer that she was exposing herself to. She partly caused the outcome of the lung cancer because her own voluntary actions did materially increase the risk of developing lung cancer, as she was exposing herself more to artium. If the defence is successful, then damages payable to Rosa will be reduced to reflect her own voluntary blameworthiness, as in Jackson and Murray, which potentially is quite high, seeing as she voluntarily exposed herself to the artium on more than one occasion. If this fails, the Tate Gallery may also argue the defence of Valenti, that Rosa, by accepting the job, consented to the risk of harm posed by the artium. As she agreed to the risk of lung cancer, it could be argued because she continued to work with the chemical solvent, unlike in Nettleship and Weston. She also potentially knew the extent of the risk that artium causes lung cancer, and by continuing to work for the Tate Gallery, freely and voluntarily agreed to incur it, as she was not coerced or anything like that, as in Morris and Murray. Rosa may also bring a second claim against Dr. Khan, but will actually be suing his employer, the hospital, who is vicariously liable for Dr. Khan's negligence, as established in Cassidy and Ministry in Health. It was also accepted in Cassidy that a doctor-patient relationship is a close one, so that Dr. Khan owes his patients, Rosa being one, a duty of care. There will be no issues in establishing this. When considering whether Dr. Khan has breached his duty towards Rosa, we have to consider whether, as in Bolam and Frean, he has acted in accordance with a practice accepted as proper. Arguably, any other reasonable breathing specialist would have probably taken more time and care to examine her more thoroughly and establish the true problem. For example, like doing more tests. However, it's kind of hard to say, but I think that he should have been more thorough. So this suggests that the Dr. Khan was in breach. As I mentioned earlier, the issue of causation in relation to Dr. Khan is a confusing one. What Rosa is essentially arguing is that Dr. Khan caused her a loss of a chance of survival. However, it seems that more evidence does need to be shown to establish this definitively. If Rosa's chance of survival before the negligence was 55%, then on the balance of probabilities, he has caused her a loss of a chance because she was more likely to survive than die. So this satisfies the but-for test, as in Barnett and Chelsea and Kensington. However, in a similar way to Gregg and Scott, if her chances were 45%, then Dr. Khan will not be liable for the loss of a chance, as she was more likely to die than survive anyway, so the but-for test fails. Applying the Wagon-Mound, a loss of a chance of survival is definitely a kind that should have been reasonably foreseen by Dr. Khan, as it is likely that if you misdiagnose someone who has a serious illness, that their rates of survival are likely to go down. But to establish whether Dr. Khan is liable, we would need more definitive answers on whether her survival rate was 45% or 55% to actually, in fact, establish whether he has breached his duty.